I've seen on television lately more incontinence products for the older female and male. So have you noticed, I mean, it is kind of a taboo at times, I would say, between the ages of 35 and maybe 55, but have you noticed people coming to you and seeking help in that area of possibly 55 and older?
Absolutely. I think a lot of people wait until, like you said, the children are out of the house. They are at the point where their pad usage is so significant that they don't know what to do, or they finally are making time for themselves. And they say it's not, sometimes it's a new problem, but most of the time, I've had this problem for a long time, it's getting worse. Or, for example, I had this type of incontinence, and now I have this type of incontinence. Or they don't realize they're different types. They just say, I was leaking like this, and now this is happening, and I don't know what to do.
Right.
And so many of the times the way they're dealing with that is they're just buying more pads or more briefs.
Right.
And I have people that are coming in saying they're using a case of briefs a day.
Oh,
And I can't imagine. I mean, they can't leave their home. They lose contact with their friends. It affects their intimate relationships. If they have any professional aspirations, they feel like that also limits them. And so it affects people on so many levels, and it doesn't need to.
right. When you had mentioned earlier menopause and andropause for men, do you think that some people look at that as, well, this is just part of what I'm going through. I don't need to talk to a physician. I don't need to see a urologist.
Well, that's the problem. We perhaps by our grandmothers or I don't know what generation has said, well, women leak when they get older. And so therefore they say, well, this is just what it is. This is what I have to endure to be a woman, but that's just not true. Because we have it more commonly does not mean we have to take it. We are lucky to have many, many good options for treatment and management.
Yeah. It's knowing that treatment and management. I would agree with you. I've had seasoned nurses tell me, any woman that's over 70 that tells you they're not incontinent is lying. And I'm like,
It's pretty
I
common.
didn't even think about that. I thought, oh, you're probably right. And they just deal with it. That's so sad. So what are some common practices as females we can adapt now to help us possibly, not be so incontinent when we're older?
So there are many factors that lead
Okay.
to incontinence, but simple things. Our general checkup with our primary care is important. Some of these things, like I said, like diabetes, heart disease, other chronic diseases affect your overall health. They cause increases in weight. Increases in weight can cause more incontinence. They cause fluid retention. Fluid retention, of course, affects all of these factors can affect urinary function. It's important to look at your fluid intake and what types of things you're drinking. There is a lot of consumption of sugared beverages, caffeinated beverages, Monster drinks, Red Bull. These things are not bladder happy. They're just not.
That's a great way to put it, bladder
They're not.
happy. I
They're
like
just-
that.
Similarly, some people, interestingly, we find people that drink a lot of carbonated beverages are really, their bladder they get a lot more frequency. So a lot of these not sugar, but fake sugar, stevia,
equal,
those are bladder irritants.
Okay.
And more importantly, some of these carbonated waters,
Yeah.
they may have no stevia, none of that, but just the
Right.
carbonation alone, in some cases, are very irritating to some women.
Wow.
So I hate to say the age-old saying of just basic water. It's not
Yeah.
a bad thing.
Yeah, don't drink
but,
your calories.
I'm not, by no means am I discouraging people from drinking everything besides water, but it's just that when caffeine and artificial things make up a majority of your fluid intake, you usually don't fare well in the urinary department.
Right. Okay. Well, I'll stick to water after I have this coffee.